Good afternoon, Dr. Michalsen. Can you hear me?
Yes, I can hear you. Can you hear me?
Yeah, I can hear you perfectly well.
Great.
Welcome to our live interview, and it's really our honor to have you here to Timepie.
Thank you.
And
It's a pleasure for me.
And just now, I've just given a brief introduction about you to our Chinese audience. But would you mind telling us maybe a little bit more about yourself and maybe the book Fasting?
Yes. Yeah, my name is Andreas Michalsen in German, and I'm a doctor, a specialist for internal medicine, cardiology, but also for natural healing, for naturopathy. And I am professor at the Berlin Charité Medical University. And I'm also director of a department for internal medicine with 90 beds. And we practice a lot of naturopathic treatments beside conventional internal medicine. But one cornerstone is diet, nutrition, and fasting. And I myself, I'm really totally convinced that fasting is one of the greatest self-care methods we can use for our health promotion.
Yes, fasting has always been a heated topic in our channel. As soon as I got my hands on the Chinese version of your book, Fasting, I couldn't wait to dive in. And we prepared several questions based on the book. Yeah, and would like to hear some expert insights from you. Shall we dive into? Yeah. The first one is that you have been the head of natural therapy department for over 10 years, but in China, there is no equivalent department as natural therapy. Could you briefly introduce the concept of natural therapy? Can natural therapy be used to combat aging?
Yes, the important message is it can be used to combat aging, of course. And the definition of naturopathy in Germany is all treatments that are principally nature-based. That means diet, nutrition, fasting, but also exercise, sport, and also stress reduction, mind-body medicine. There is I think there is a link to China because we also use Tai Chi and Qigong as stress reduction methods. Yeah. And the fourth pillar is all what has to do with temperature. That means ice bath, hot bath, water in hot and cold applications, or sauna therapy. And these four treatments try to stimulate the self-healing capacity of the body. That's the common denominator. It's self-care, self-healing. And from all what we know is that it promotes longevity.
Yeah, and there are many aspects of natural therapy, and I think some of them are related to the traditional Chinese medicine department, I think.
Yeah.
And yeah, at the very beginning of the book, you mentioned that some age-related diseases are actually closely connected to our daily lifestyle, especially diet. In your opinion, how much impact does diet and fasting have on our human aging?
It has a lot of impact. I mean, from these four factors I mentioned, all science tells us that diet and nutrition and fasting is the most powerful. Yeah? Exercise is also important, but when it comes to longevity, to aging, fasting and diet is more important. And as you, in your question, you ask the diseases that are associated with aging.
Age-related disease, yeah.
Yeah, and that's, at least in Germany, that's a big issue, because most of the people die from age-related diseases like diabetes type 2, heart disease, hypertension, some cancers that are age-related. And so naturopathy, diet and fasting, for example, can cure up to 90% of cases of diabetes type 2 if practiced, or can treat 80% of hypertension. And so there is a clear link that with these naturopathic lifestyle treatments, we can really treat and cure these age-related diseases. And when we treat the age-related diseases, then we are getting older, of course. Yeah? Maybe not 200 years, but I think 100 up to 120 years is possible.
Yeah, there are many benefits of fasting, from to cure some age-related diseases to our final goal is always to extend our lifespan. But could you please maybe elaborate on what is the mechanisms behind the longevity benefit?
What is the
mechanisms? What is how can the fasting extend our lifestyle? What is the molecular level
Well, we now define in basic science 12 hallmarks of aging. I will not elaborate on it.
12 hallmarks,
but these are mostly molecular signals that deteriorate with aging. And on the other side, we have like a deterioration of cell repair, cell cleansing, and DNA repair. And on the other side, these molecular hallmarks like mTOR is one of those, or sirtuins. And what's most interesting about fasting is when you regard these hallmarks, nearly all of them are improved by fasting, like DNA repair, autophagy, mTOR, sirtuins, stem cell rejuvenation. That's all backed up by science, that fasting indeed improves all these age-related molecular signals. That doesn't mean that, I mean, these are all animal experiments. We have always to be a little bit careful when we have evidence from animals, from mice. We cannot translate it one-to-one to human people. But I think it's very, very likely that fasting promotes longevity because all these mechanisms are improved.
Yeah, you just mentioned the hallmarks of aging, and I noticed that in the chapter 1, I think in your book, you mentioned the imbalance of intestinal microbiota, and you mentioned that the intestinal microbiota has its own biological rhythm. Exactly. And how can we regulate the rhythm through fasting in order to promote our longevity?
Fasting has two benefits for the microbiome, for the microbiota. And as you mentioned, the microbiota is clearly one of the key components of health and healthy aging. Yeah. And what's very fascinating is when you are fasting, either if you are fasting for a few days or if you practice intermittent fasting, the bowel itself starts a cleansing reflex. You can hear it also. These are the bowel movements after 10, 14, 16 hours. They are stronger, they are accelerated, and that's a cleansing process. And on the other hand, the bowel itself is free of digestive work. And that's how we explain that any type of fasting improves the richness, the diversity, and the balance of the microbiome, of the microbiota. What we don't know exactly what is the optimum time and what is you mentioned the rhythm. So probably it's good to extend the nightly fasting, but we don't know if it's now better 14 or 16 or 18 hours or early or late. That's not yet proven.
Yeah, maybe it depends on the people's conditions, like
exactly.
Their habits.
That's what we analyze in our data now, that we see that a lot of people are they wake up very early in the morning. Some very extend nightlife until 1 o'clock or 2 o'clock. And sure, it makes a difference how your life rhythm, your biorhythm is, to adapt, to tailor your way of intermittent fasting. Yeah, that's probably very important.
Yeah. And in chapter 2, you analyze the impact of different nutrients. For example, although protein promotes the growth, it also accelerates aging, and you suggest that in order to live longer, people should eat less fish or fewer or no dairy product at all. This seems somewhat contrary to our common sense, because people may think that protein is good for our health. What do you think is the reason behind?
It's a big controversy. It's a big discussion. Yeah, and I think two points we have to differentiate. The one is clear, is very clear. I mean, if we read all the data from researchers, from aging researchers like Luigi Fontana, Walter Longo, Mark Madsen, we know very clearly that protein, and especially animal protein in excess, accelerates aging in the cell. That's a biological law almost, yeah. But there's another point. You mentioned that protein, when we grow, is very important for children in the youth. But it's also important to avoid weakness and frailty when you are over 60, 65 years old. So now this is kind of a contradiction. Yeah. So I think it's very good to eat protein, sufficient good protein until you're 20 years old. Between 20 and 60, I would recommend to cut down on protein. And then after 60, 65 years of age to get a little bit more protein again, to avoid muscle weakness. But the critical thing is that most people think protein is good, it's important, it makes you strong. Yes, it makes you strong, but it damages your cells. So you have really to find your balance. And I really would recommend not to drink protein shakes for anti-aging. It's not a good idea.
Yeah, there are many people who work out in the gyms. Very often they would taking the protein shake. Yeah.
Yeah, they love it. And of course they get more muscles. No doubt about it. Yeah, but their cells are aging.
Yeah. What are the differences between therapeutic fasting and intermittent fasting? I think in your book you differentiate these two concepts, the therapeutic fasting and intermittent. Yeah.
Yeah, it's the timeline. The timeline is the difference. Yeah, with intermittent fasting, today the most prominent type is the time-restricted eating, where you have a break of eating of 16 hours or 14 hours. Yeah, and therapeutic fasting, on the other hand, has a long tradition in Germany, in all Europe. And there you practice fasting for several days, up to 2 weeks. If you are obese, yeah, you can do it for 3 weeks. I will not recommend to everybody. And this therapeutic fasting of several days has an even stronger effect on cell rejuvenation. But it's a little bit, you need a little bit more discipline, of course. Yeah.
And yeah, compared to the therapeutic fasting, intermittent fasting may be a better practice to adhere to insist on. But there are many kinds of intermittent fasting, from 16 plus 8 hour or the 5-2 intermittent fasting. Yeah. How to choose the most suitable fasting method for oneself? What aspects should we consider or judge when we are trying to practice?
Well, you mentioned 5-2. I think this was in the early era of research. This was quite popular, but it turned out that most people don't stay, they don't keep this type of intermittent fasting. So I would say 5-2 is no more a good choice.
Yeah.
Also, there's every other day fasting or every other day diet. It's
Mhm.
also, that's not realistic. And every second day fasting. You can do that for 3 months in a study, but not in your real life. Yeah. So the winner is, regarding intermittent fasting, the time-restricted eating. And there, my opinion is that most of the science started with 16 to 8. As you know, you eat everything you eat in 8-hour window. But it turned out that 14 to 10 has mostly 80% of the effects of 16-8. And 14 to 10 is, of course, easier to practice. So I think regarding sustainability, I recommend 14 to 10 to my patients. Because 14 to 10, you can also bring in line with your family or your work life. 16-8 is sometimes, yeah, I mean, then who wants to skip dinner? Dinner is nice with friends or with family. Yeah. Skipping breakfast is also not that good because breakfast is an important meal. Yeah, so I think 14 to 10 is the best.
Yeah, actually, I haven't heard about 14 plus 10 before, but now I've heard that I think 10 hours is good news because I can eat for longer compared to other option.
Yeah, 14 to 10 means you can have breakfast, let's say, at 9 o'clock, and then you have dinner at 7 p.m. That's easy to handle, yeah. And still, as I mentioned, you have a lot of the benefits regarding diabetes, blood pressure, sleep quality, vitality.
And how should we understand that fasting is not the same as starving? Commonly, we think that fasting will bring the sense of hunger, and many people will worry that they may have the nutritional deficiency during this process. And
Yeah,
will
important question. The first thing is that when you start fasting for the first time, you perceive hunger. Yeah, in the first time, because your body is used to it. Let's say you start intermittent fasting, and you have always breakfast at 7 o'clock, and when you then start intermittent fasting and you have breakfast at 10 o'clock, you will feel hungry at 9 o'clock. Yeah, but after 3 or 4 weeks, your body adapts and then the hunger goes away. And with therapeutic fasting for several days, it's the point that you feel maybe hungry the first 24 hours, but then your body produces ketone bodies. Ketones. This is the alternative to sugar. It is produced by the liver. And ketones give you a feeling of satiety, so you don't feel hungry anymore. And there's a next point. The more frequently you practice fasting, the better it works, the less you feel hungry at all. And your last point, nobody has to be afraid that there is a deficiency in vitamins or in micronutrients. Not at all. We always have to take into account that our ancestors, humans, hundreds of thousands of years before, they never had 24 hours to eat. They had no refrigerator. They had no restaurants. Our body is well adapted for having large breaks of energy intake. So there is no deficiency.
Yeah. And another question is that in the book, you provided a therapeutic fasting menu for 5 days, which consists mainly of liquids fasting days, such as the soups or vegetable soups or other liquid. which is quite similar to the previous popular liquid fasting method to anti-aging or to lose weight. But it is reported that this liquid fasting has a rebound effect, that they may regain their fats afterward. How do you view this issue?
That's also a very important question. So we have here in my hospital, we have two types of fasting. The one is the diet with the liquids, as you mentioned, yeah. And here it is important that it's really only 200-300 calories a day. It's really an almost total fasting. And it is combined with a little bit of exercise and stress reduction. And we have data from more than 15,000 patients in our hospital, and we have no rebound of weight or of appetite or binge eating or stuff like that. But I think it's important to do it that classical way. If it's not familiar, for example, these techniques in China, another option would be the fasting mimicking diet developed by Walter Longo, where you consume about 600 calories a day. It's vegan, it's sugar-free, and so you still have a lot of the fasting effects. And also there you have no rebound. So I think this weight cycling, these rebound effects are no issue for the modern types of fasting.
Yeah, just now you mentioned the fasting mimicking diet, and actually one of our audience has raised a question in our live streaming, and she was wondering that if the FMD or fasting for more than 3 days can harm the thyroid, our thyroid.
No, not at all. No. As I mentioned, I mean, the therapeutic fasting or the fasting mimicking diet for 5 to 7 days, there are not many problems. A lot of people suffer in the first day from headache, but that goes away. That may be also due to coffee. If you drink a lot of coffee and then you stop drinking coffee, you get headache. So I recommend then to drink maybe a cup of coffee during fasting. Then it's easier, yeah. But there are two problems with fasting. People should be alert. The one is gallstones. If people have symptoms of gallstones, they should not fast. And the other point is gout, the type of arthritis due to uric acid. That also goes higher in fasting. And so these two diseases should be prudent with fasting, gallbladder disease and gout. But there are, and of course, people that suffer from anorexia nervosa, that are underweight, they should not fast. But all other people can fast, and the thyroid is not at all a problem.
Yeah. And in the therapeutic fasting, does the fasting phase performance, or which has the performance of through smooth and elastic skin, soften connective tissue, or thicken tongue coating? Well, can this indicate that the therapeutic fasting rejuvenates individuals, the so-called fasting phase? Yeah.
Exactly. I mean, the fasting phase has two components. The one is that the skin gets clearer, gets more beautiful, gets nicer. Maybe during fasting, in the last fasting days, you get a little bit more wrinkles, but this is due because you lose a lot of water. And then when at the end of fasting you drink again water and have an intake of salt, you really see a better skin, a more beautiful face. That's what we see in our daily life in patients. How to say, I'm a doctor, I'm not a beauty specialist, but But of course, it's a nice side effect.
A good side effect, yeah.
Yeah.
And how long should one insist to in order to see the results of the fasting phase? Like,
Well, as I mentioned, when you with these two types, with intermittent fasting, you for receiving the benefits, you have to follow for about 4 weeks, yeah, and at least 5 days a week. So you have really to do it on most days of the week. When you do therapeutic fasting for continuous days, as mentioned, the first day is not so easy. You really have to go through. The first day is not nice. But then on the second, on the third day, the metabolic switch happens, the ketone bodies increase. And the day where most people feel very well and say, wow, that's a very nice feeling, is then the fourth and fifth day. Yeah, there you have really the benefits of fasting.
And during fasting, there can be many aiding methods in order to promote the process, such as applying some heat to your liver or the so-called Kneippgrüße. Am I pronouncing it right?
Yeah, wonderful. Yeah.
Regarding the latter one, the so-called the cold shower, is that the kind of cold shower?
So it's good to combine fasting with stimulation by temperature. Yeah, so we can clean the body, the cells, we can rejuvenate our body by fasting, a little bit by exercise, but also by kind of extreme temperatures. So you can go to a sauna, or you can go to a cryo chamber, an ice bath. I don't know if you have that in China. Yeah, it's or in Germany we use cold water shower or pourings. Yeah, where you just put your shower to a stronger water flow, and you let it flow for 1 minute so that it becomes colder and colder, and then you start really to shower that way. In the beginning, that's not nice. Yeah, in the beginning, you don't feel well. But it's like sports. Your body works, your body adapts, and from all what we know is that this enhances the success of fasting.
And the cold bath actually is also related to longevity. Some biohackers may use the cold bath method as a way to extend their lifespan. So can the so-called Kneippgrüße also enhance the anti-aging effect of fasting in this sense?
That depends on the intensity. So we now think that the benefits of the ice bath depends on brown fat. When you experience a lot of cold, either by water or cold temperature, and you have no warm clothing, your body builds brown fat tissue. And this brown fat is very, very good for the body. It protects against diabetes, heart disease, and it turns out that it also has a good effect on longevity. So the ice bath is the strongest. Yeah, you go there, or the cryo chamber, you go for 1 minute and you shiver, you really feel cold. You can also do it with a Kneippguss, but then you have to do it a little bit longer. Yeah, you really have to feel cold. Yeah, but you should not exaggerate that you don't get a cough or a cold. You have to find out what's your way to stimulate your body, but not getting sick by cold. Yeah.
Catch a cold.
That's the other side of the coin. Yeah. But we have studies when, for example, children and younger people, when they have every day a Kneipp cold shower, in the winter they have less infections, less cough, less colds. So it protects and stimulates the immune system also.
Yeah. And the last question is about your own experience. You mentioned in your book that you decided to be a vegetarian at the age of 40. Did you experience any positive anti-aging effect after that? For example, changes in your energy level or alleviation of some diseases or alignments?
Yes, of course. I mean, there are some aging aspects I could not influence. In my family, there's a lot of gray hair, so I couldn't influence that. But in fact, what I really found out that since I turned to a plant-based vegetarian diet, I have now for 23 years since I did that, a very low blood pressure, I have a low heart rate, I have no medication, I have total good vitality the whole year. And so I'm very happy with that because, I feel just as healthy as 40 years ago. I don't know if is it the vegetarian diet? Maybe, yeah. Or is it the fasting? Because I'm also practicing a lot of fasting. So.
Yeah, and we've just finished the prepared question, but during the live interview, many audience, they are very passionate and ask about their own questions, and I pick out some of them. Would you mind that I convey their question to you? And one of them is related to the age. Is it feasible for a 78-year-old person to start fasting?
Yes.
Or from the middle age, yeah.
Yeah, it is. I would first start with intermittent fasting, as the first step, do 16-8 or 14-10 for 4 weeks. And then when she or he is used to it, then I would try a 5-day fasting mimicking diet.
Mm-hmm. And another people is wondering, will fasting combined with spermidine, the supplement spermidine, or other autophagy enhancing supplements be more effective? Will it make the fasting process more?
We don't know by clinical studies, but from the basic science, I'm also in close research cooperation with Frank Madeo. He's the leader in the spermidine research, and we both agree that it probably makes sense to combine fasting and intake of spermidine. And I mentioned, by the way, coffee, and coffee is another autophagy enhancer, and therefore it also makes in previous time, one said fasting should be done without coffee. Now I think that it's a good idea to drink coffee and fast. Both enhances autophagy.
Yeah, but another audience is wondering, can we consume sugar-free coffee or both are fine? Sugar with sugar or without sugar are fine.
Well, sugar-free, yeah, because sugar has too many calories, too many energy. So sugar-free, maybe a little milk foam, but not too much. Yeah.
Mm-hmm. And are you a 100% vegan diet? Are you practice 100%?
No, I'm 100% vegetarian, a lacto-vegetarian. That means I don't eat meat, fish, and eggs. I don't eat at all, but I eat a little bit of cheese and yogurt. So I'm not a full vegan, but a 100% vegetarian.
Mm-hmm. And another question is that why is fasting not suitable for patients with arthritis?
It's very, that's a good question, because it's very suitable for patients with classic arthritis, with osteoarthritis, also with rheumatic disease. Very, very good success. So it's anti-inflammatory, so you have within 3 or 4 days better joint function, less pain. There's only this one single type of arthritis that's related to gout. That's the only type of arthritis where fasting is not good. For all other arthritis forms, fasting is excellent.
And another audience is quite worried about whether fasting will have some harms on the skin. Does the fasting cause loss of collagen?
No, it does not. To make it clear, I mean, fasting is only a break. Yeah, I mean, nobody is fasting for years. Yeah, and as fasting has large effects on autophagy, where old proteins are recycled. Fasting has a good effect on the protein metabolism. That means during the fasting day, of course, when you fast, during the fasting days, you have no big protein intake. There's no benefits on the skin. But when you then eat again, your protein metabolism works better. So after fasting, you have improvement of skin. And that's also the reason why we do fasting in some skin diseases, like psoriasis or eczema. We see very good results.
Yeah. Is it more beneficial to start fasting at maybe 18 years old, sorry, or is it better to start as early as possible? Do you recommend?
Children and people under 18 should not fast. So I mean, yeah, maybe you could fast with 17 or 18, but we said until the age of 18, when growth is not yet finished, you should not fast. Then it's really after that. I mean, we had the question. You can also start with 80 years fasting. I had a patient with 96 years that fasted for the first time. But of course, it's better when you practice a little bit earlier. It's like sports. It has a lot of similarities with sport. And when you practice sports, when you are 18 years old, it's better as when you start with 80. Yeah. So it's good to start early.
Do you have any kinds of probiotic supplements to recommend in your?
No, I mean, the microbiome is very important. We know that, but currently, I think we cannot really prescribe precisely probiotics. I think this will start in 3 or 5 years. We do now a lot of measurements, gene sequencing, but today I just recommend to eat a plant-based diet with a lot of fiber, whole grains, and to eat fermented food like shoyu, kimchi, yogurt. I think in the Chinese diet, I think you have a lot of fermented foods. So I think this is the best what you can do, and fiber, and then you don't need a probiotic.
And fasting can also cause the constipation when we practice the fasting. And in your book, you recommend to use enemas to improve this issue. How often should enemas be done? And is there any alternate option?
Well, what's important, it's quite normal that when you fast, then after 2 or 3 days, you have no stool anymore, of course, because you have when you don't eat something, you cannot have further stool. So that's not constipation, that's quite normal. There is a tradition that to clean the bowel, it's good to have every 2nd or 3rd day an enema, or to drink a kind of fluid that promotes bowel movements. But it's not necessary. I mean, if you suffer from constipation, it would I think it's good to have these enemas, but everybody can fast without these bowel cleansing measures. My friend Walter Longo, for example, who developed the fasting mimicking diet, he never used any type of bowel cleansing or enema. And our group and his group, we have almost the same results. So I think it's not really important.
And another audience is wondering, can fasting alone be used to treat cancer, or can people with tumors also practice fasting? What is the benefits?
No. Fasting in cancer is really very, very difficult. Fasting cannot cure cancer. Chemotherapy and surgery is the most important. There are some preliminary data from our group that chemotherapy is better tolerated when you have 48 hours of fasting before and after. So in total, 2 days fasting. But it's still, I would not recommend yet that for cancer treatment. For cancer, two things are very important. The first is you should not lose too much weight, with the exception when you are obese. Okay, then it's good to lose weight. But when you have a normal weight, you should not lose too much weight. And my second recommendation is to eat really a wholesome, plant-based, good diet with a lot of secondary plant substances. That's very good against cancer. Berries, nuts, legumes. So that's all very good.
And how should one begin the recovery after the fasting? And how to control the fasting period and the recovery period?
Yeah, when you now fast for 5 days, it's quite easy. Then you make 1 day just with a little bit of soup, or a light meal with rice and some vegetables. Yeah. When you fast longer for 7 or 10 days, you should build up your diet for 3 days. So in the first day, only soups. In the second day, then small portions of rice and vegetables. And the third day, you eat like normal.
And how do you view fasting mimicking products?
Well, we also experience with fasting mimicking products. It's okay. I mean, it's convenient. If you say, well, I don't want to spend so much money, you can cook it by yourself. It's not very complicated. Yeah, you should not exceed 600 calories a day. It should be vegan and without added sugar. So if you just cook some soup or rice and vegetables, you can do for really less money your own fasting mimicking diet.
And another one is that you mentioned in your book, before the breakfast, we should use oil to stimulate the digestive tract. What are the effects of this method?
Yeah, this is also an old tradition, but it's now proven by scientific data that when you ingest, you don't swallow, you just take one big spoon of oil, like sunflower oil or sesame oil or olive oil, and then you chew it for 1 minute. That's very good for digestion, and it's also a protection against parodontitis, yeah, the inflammation of the skin in the mouth. So that's a very nice recommendation. Yeah, 1 minute, and then you spit it out and give it away.
And another one is a quite interesting one. Seeing food or watching some live shows while we are fasting about the food will affect the digestive system, because when we are when we are practicing the fasting, when we see the food, because we cannot eat anything, when we see the food or people who are eating the food, will it affect our digestive system? Because we are continuously,
a little bit. Of course, when you see people eating, and when you have the smell in your brain, in your brain, some processes start to draw you to the food. But
appetite,
yeah, but in fact, I mean, in Germany, fasting has a very strong tradition in the population. And for example, when I'm fasting, I also cook for my kids or for my family. Or a lot of people that are fasting, they cook for their families, or they go to a restaurant and they only drink the water. I mean, you need a little bit of discipline. That's for sure. But it's not so difficult.
And let's come to the final question. What's your attitude towards ketogenic diet? And what diet should women with polycystic ovary syndrome follow? Yeah.
So the first question, the
ketogenic
diet. Well, there are a few indications, like epilepsy, the brain disease, or maybe some desperate cases of multiple sclerosis where we use it. But I don't like the ketogenic diet. You lose weight with it, that's true. But there's a lot of data that show that it's bad for your blood vessels, for your heart, for your immune system, and that it accelerates inflammation. There's only one ketogenic diet that's good, but that's very hard to follow. That's a plant-based ketogenic diet, but it's really I don't think that everybody can follow for more than a few weeks. And the polycystic syndrome, it's difficult to treat, but we have some success with a combination of 2 cycles of fasting mimicking diet for 5 days. 1 month, 5 days fasting, 2nd month, 5 days fasting, and then a plant-based or mostly vegetarian diet thereafter. Yeah, because this has then a strong anti-inflammatory effect. Sometimes we also give curcumin, the spice, turmeric, the spice, to augment it.
Yeah, and now let's come to the end of our interview. Would you mind to give a conclusion of today's interview or the book Fasting?
Well, yeah, my conclusion is that sometimes we think that disease is a fate. There is no escape, and we only have surgery or pills. And my professional conclusion is, if we combine fasting, a healthy diet, and the other naturopathic aspects, we have really a very good chance, first to get very old, and to stay vital and mobile, maybe until the last weeks of our life. And so I think it's a good prospect to say, it's not God-given that we all get aged and diseased. We all have to die, but we can do a lot to stay healthy.
Thank you very much, Dr. Michalsen, for taking the time to share your insights with us today. And your expertise on fasting and holistic health has really enlightening for our audience. And for everyone watching, if you are interested in learning more, be sure to check out Dr. Michalsen's book, Fasting. And thank you once again, Dr. Michalsen.
Yeah. Thank you. It was a pleasure, and greetings to China.
And have a nice day.
Have a nice day. Bye-bye.
Bye. Bye.